Hi, my name is Mike Cascio. I'm the Clinical Director of JAG-ONE Physical Therapy in Cherry Hill, and I'm a Titleist Performance Institute certified physical therapist, which means I specialize in working with golfers. Today we're going to be introducing JAG-ONE Physical Therapy's Golf Rehabilitation Series, where we're going to talk a lot about how to prevent injury and improve performance on the golf course. Physical limitations, that's limitations in mobility and stability, can lead to inefficiencies in your swing, which will cause issues with inconsistent ball striking and can even be causal factors for pain. Let's talk about the golf swing. If done efficiently, the golf swing requires a combination of power production, joint mobility, stability, flexibility, coordination, and balance. The golf swing is an athletic move and should be trained like one, just like any other sport. PGA Tour professionals have certainly caught on to this trend, working with Titleist Performance Institute specialists to both improve their performance and their longevity. If you're not paying attention to the physical attributes involved in your golf swing, you're doing yourself a disservice. The Titleist Performance Institute screening, or TPI screening, is an effective way to identify limitations that may be compromising performance. For example, if someone has limited hip rotational mobility in their golf swing, that means their ability to rotate their hips in order to get all the way through their backswing and their downswing. If they can't rotate through their hips, we're going to see some compensation. So, for example, in order for me to get all the way to the top of my backswing, if I can't rotate my hips, I'm going to have to do something like this. This is called a reverse spine angle, and it's very common to see in players with limited hip mobility, and over time, that's going to result in a major cause of low back pain. All right, so now I'm going to give a demonstration on one of the Titleist Performance Institute screening tools where we look to screen for limitations in lower quarter rotation. So as I mentioned previously, limited lower quarter rotation can cause compensations in your swing that can lead to other things like low back pain. So what I have here is I have two 6-irons on the ground. We use a 6-iron because it creates a 60-degree angle at the club shaft, or at the club head. And John here is going to demonstrate the test. So first we're going to look at his hip rotational mobility in his backswing. So we'll start on the left leg, so his lead leg, and we're going to look to see how he rotates through his lead leg. So he's rotating, and that looks pretty solid. What I'm looking for is the two hip bones to be lined up if I were to draw a line with the club. And he's able to do that through his lead leg, so that's good. So let's go ahead and look at the back leg. So John's going to go ahead and rotate into his backswing on his back leg, and we actually see a pretty significant limitation here. This could result in some compensations in order for him to get back all the way into his backswing. So let's go ahead and finish the test. Now we're going to look at the downswing. Left foot rotating through. Yep. And again, the left hip looks like it's testing pretty well. Let's go ahead and look at the right one. And other way, towards me. That's all right. And both hips rotate pretty well on the downswing. So what we have here is a potential limitation in his right hip mobility on the backswing, which is something that we could screen for further and come up with a treatment plan to try to address.